Based on global statistics, the top 3 leading causes of death among women are heart diseases, which include coronary heart diseases, cardiac arrhythmia, and heart failures, among others. The second is cancers, which include breast, ovarian, and cervical cancer. And the third, depression and anxiety. The number of deaths from these health conditions can be significantly reduced if proper health actions are being taken. However, most women ignore them, and hence the high fatality rate. In today's video, we'll briefly talk about simple health actions women ignore that can literally save their lives and or improve their quality of life. Greetings, I'm Dr. Tawad, a general practitioner. This video is born from a deep reservoir of my love and respect for the women in my life and women everywhere. So let's embark onto this insightful journey. The first health action is the human papilloma virus is the name of a very common group of viruses which commonly affect the skin. One can get HPV by having vaginal, anal, or oral sex with someone that has the virus, which is usually the most common means of spread. The disease could also be spread via close contact with an infected individual. Most people who have it do not even realize that they do, and they usually do not even have physical manifestations of the disease. A person with HPV can pass the infection to someone even when they have no signs or symptoms. There are more than 100 different types of the human papilloma virus, and although most of them do not cause any problem in most people, some types can lead to genital wart or cancer, leading us to the HPV type 16 and 18, which cause the greatest risk of cervical cancer, and hence the human papilloma virus vaccine, which among other measures is a very great move towards preventing this infection. Children between the ages of 11 and 12 should get 2 doses of the HPV vaccine given 6 to 12 months apart. The HPV vaccine can also be given starting at the age of 9. Children who start the HPV vaccine series on or after the 14th or some say 15th birthday would need 3 doses given over 6 to 7 months. HPV infections and cervical precancers, which are abnormal cells on the cervix that can lead to cancer, have dropped since 2006 when the HPV vaccines were first used in the United States. Among teen girls, infections with HPV types that cause HPV cancers and genital warts have dropped by 88%. And among young adult women, infections with HPV types that cause most HPV cancers and genital warts have dropped by 81%. Then among vaccinated women, the percentage of cervical precancers caused by HPV types most often linked to cervical cancer have dropped by 40%. HPV vaccination is actually not recommended to anyone older than 26 years because the vaccine provides less benefits compared to the younger ones, because more people at this age range had already been exposed to the virus. But some adults aged between 27 to 45 years who were not already vaccinated might choose to still get the vaccine after speaking with their doctors about their risk for new infections and possible benefits of the vaccination to them. So for all you watching this video, if you are beyond the age of benefiting from the vaccine, you can do so for your daughters and share it among parents too. Now will also be a good time for you to like this video and subscribe if you're yet to do so, especially if you enjoy content that I make. Let's go back. But for women who are aged 21 years and above, the next health action is going to benefit you. This health action is screening. Means checking for a disease before there are symptoms, and cervical cells begin to change before they even become cancerous, and at this stage the person affected will not even notice anything. The goal of screening for cervical cancer is to find precancerous cervical cell changes when treatment can prevent cervical cancer from developing. But sometimes cancer is even found during the cervical screening. Cervical cancer found at an early stage is usually easier to treat. By the time the symptoms appear, cervical cancer might have begun to spread, making treatment more difficult. And there are usually 3 main ways to screen for cervical cancer. The first one is the human papilloma virus test, which checks the cervical cells for infections with high-risk HPV types that can cause the cervical cancer. The pap test, another test also known as pap smear or cervical cytology, collects cervical cells so that they can be checked for changes caused by HPV that may, if left untreated, turn into cervical cancer. It can find precancerous cells and even cervical cancer cells. A pap test also sometimes finds conditions that are not even cancers at all, such as infections or inflammation. The next test is the HPV pap PAP-co test that uses an HPV test and PAP test together to check for both high-risk HPV and cervical cell changes. The U.S. Preventive Special Task Force (USPSTF) recommends getting your first PAP test at the age of 21, followed by PAP testing every 3 years. Even if you're sexually active, you do not need a PAP test before the age of 21. USPSTF recommends also that those between 30 to 65 years getting screened for cervical cancer using any of the following methods: HPV test every 5 years, HPV PAP-co test every 5 years, or the PAP test alone every 3 years. Now we'll move to the third most important but commonly ignored habit, which is women are slightly more likely than men to have obesity. In the US, more than 2 out of 3 women are either overweight or obese. These fatty tissues in our bodies, known as adipose tissues, that serve a lot of functions, which include storage of energy, insulation from extreme temperatures, and cushioning around soft organs, are essential to us. However, in cases where the body is exposed to excessive energy intake, it induces these adipose tissues to increase in size. This excessive energy intake also cause the formation of fatty tissues around internal organs such as the heart and the liver that can cause eventual damage of these organs. Despite that, the truth is nobody fully understands obesity till date. Perhaps one of the reasons why it's poorly understood, underdiagnosed, and undertreated is because of its multifactorial reasons. People gain weight when they eat more calories than they burn through activities. We live in a world that high-caloric foods are more available compared to the past, and they are cheaper. The world is also getting more and more sedentary. People are engaging in less physical activities, and as such, the body does not consume the calories it needs, which further leads to obesity. So higher caloric diets available and lower caloric utilization eventually lead to caloric imbalance, and this imbalance is the greatest contributor of weight gain. The world around us influences our ability to maintain a healthy weight. For example, some societies encourage obesity. I come from the part of the world that celebrates married women gaining weight, which is a sign of enjoyment. The men are also left out. A tribe in Mauritius see overweight women as beautiful, and as such, young ladies are continually given food that will make them overweight. However, this is changing with proper education. At the same time, in developed and many developing countries, women are beginning to accept the truth that obesity is not healthy, and as such are making efforts towards reversing that. Then, not having enough parks, sidewalks, and affordable gyms makes it further harder for people to be physically active. Some people don't even have access to supermarkets or stores that sell affordable healthy foods such as fresh fruits and vegetables. Do you know some people that eat a lot but are slim, whereas there are some overweight people that don't even eat that much? I'm sure your answer is yes. And this happens because research have shown that genetics also plays a role in obesity. Scientists believe that genes may increase a person's likelihood of having obesity, but that outside factors such as an abundant food supply and or little physical activities may be required for that person to also have excessive weight gain. Genetic disorders such as Prader-Willi syndrome also directly cause obesity. Some health conditions and medications also contribute to weight gain, such as hypothyroidism, Cushing syndrome, polycystic ovarian syndrome. Medications such as corticosteroids, antidepressants, and seizure medicine also contribute to weight gain. Studies have found that the less people sleep, the more likely they are to be overweight or obese. This is partly because hormones that are released during sleep help control appetite and the body's use of energy. In contrast, sleep was not a factor in the development of obesity in adults who slept longer. Some people find themselves eating more than usual when they're bored, angry, upset, or stressed. And this is because ongoing stress causes the release of a hormone called cortisol. This hormone increases a person's appetite, and if the stress persists, cortisol and appetite levels remain increased. So from all this, we can see that major factors that contribute to being overweight or obesity are things that are beyond an individual's control. But we still can't deny the fact that obesity is not healthy, as it has been linked to conditions such as hypertension, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, and some forms of cancers, which include breast, ovarian, endometrial, thyroid, liver, and gallbladder cancer. Healthy Losing weight isn't about having an athlete's body or following a particular diet or program. As we found out, it's different strokes for different folks. Instead, it involves a lifestyle with healthy eating patterns, regular physical activities, and proper stress management. People with gradual, steady weight loss, about 1 to 2 kilograms per week, are more likely to keep the weight off than people who lose weight quickly. Some are so eager to lose weight quickly that unfortunately they fall prey to exploitative companies and individuals that are after their resources by promising fast weight loss by the use of some of their products or engaging in exercises or activities that they recommend. If you happen to be overweight, go to the hospital, see the physician who will properly guide you to not only effective means of weight loss but also sustainable means of doing so. I need to quickly add that we shouldn't use this as a basis to body shame people that are overweight or obese, because as we've seen, many reasons why many are overweight is due to factors that are beyond their control. You can watch the 2 remaining factors in my next video. The link is in the description box.